Hello, I'm Dr. Russel Libby, and I welcome you to the world of medicine. You know, on the show, we learn about important topics in healthcare, in medicine, through the experiences of a studio audience. Our studio audience today has a very interesting set of issues, and that's kidney disease. Kidney disease is one of those kinds of problems that creeps up on people. They don't often know until they're really at a point where there takes a very significant turn in their life and health. And then it is a very difficult course once that happens. We're going to learn about how that happens, what are the different types of conditions people have that may predispose them to kidney disease. We're going to find out also about some of the treatments, dialysis and transplants. And we have an incredible group of people here who have actually donated their kidneys, living donors, who have donated the kidneys in a very interesting variety of situations to help people with significant kidney disease continue to live a fairly and really quite healthy life. Now, kidney disease is a real issue in this country. Probably 500,000 people have chronic and progressive problems. It costs our country somewhere close to $35 billion a year to help take care of these folks. So it's something you need to know about. And we have a great audience here who's going to help us understand that. We have Dr. Ken Gioli, one of our preeminent nephrologists, a kidney specialist here in Northern Virginia. He's a good friend and an excellent physician. He's going to fill in all those details that we need to know. First thing we're going to try to understand is why everyone has joined our audience. And we have some pretty interesting stories. Are you here as a patient, as a donor, as a caregiver?
I'm a donor.
You're a donor. Very good. And you?
I'm here as a kidney recipient, and I'd like to say right now, Dr. Libby, that my kidney donor is my wife.
Oh, right.
She's an angel.
Oh, that's a beautiful thing. And let me ask you this. Your kidney disease started at about what time?
Probably in late 2002.
Okay.
At that point, I was sent by my primary physician to a kidney specialist, and in around 2003, it started getting worse.
Yeah. Had you had any idea that your kidneys were a problem until
None.
that time?
By the time I got to Dr. Gioli, I was transferred because he's in Virginia, and a doctor in his practice transferred me to him. I had already accepted the fact that I had kidney disease, but we had a favorite conversation. He would say, "How you doing?" And I'd say, "I'm doing fine." And he says, "Well, your measures are real bad." Of course, we'd use different words, but they're not for publication here.
Right.
But what could I do? But he's the one that's got the medical test. He's a doctor.
Okay. We're going to hear more about how that evolved and what's going on for you. Donor, recipient.
Donor.
Donor.
Living donor.
Living donor. And you look pretty healthy, all
feel good.
things considered. That's
Yep.
great.
Patient.
You're a patient. Okay. We're going to hear about what happened to you. Now, have you had a lot of experience with kidneys and kidney disease?
Yes. I didn't have any kidney disease. I lost my kidney as a result of a medical misdiagnosis. Other than kidney disease, I'm healthy. I was overseas, and the embassy doctor said, you have urinary tract infection. It turned out it was urinary tract obstruction. Okay. 7 months later, while watching the French Open and eating strawberries and cream, I vomited. And when I vomited a second time, and the second time was bile, I said, "We got a problem." And they said, "Yes, your kidney isn't working."
So here's another case where really you didn't have much awareness that you had a problem with your kidneys, and then lo and behold, it was bang. You're a patient.
Patient.
Okay. And when did you start having problems with your kidneys?
Problems. I started realizing that it was going bad in 1990-something, in the last half of 1990.
Most of your life, you had no idea anything could ever go wrong with your
No
kidneys.
idea.
And you, caregiver, patient?
I'm a caregiver.
You're a caregiver.
Yes.
You're an angel as well.
That's right.
That's right. And you?
I'm a donor.
You're a donor, and you look like a healthy donor as well, which is always a good thing.
Yes, I am.
And I know that you have a very interesting story, and certainly one that we are going to explore because I think it's really wonderful.
Okay.
I'm a caregiver. I'm Stephanie's father. I would have been the donor if I could have been, but as you said, there's an interesting story about who she donated to.
Right. We're going to learn about that.
I'm a dialysis patient.
You're a dialysis patient.
Right.
So instead of the transplant side, you're in the active dialysis side.
Exactly.
And how long have you been?
I've been on dialysis about 2 years.
2 years, okay. And did you have any inclination that your kidneys were starting to fail at some point in your life?
In the 90s, my creatinine levels started coming up. I would go for MRI, or rather CAT scans, and they wouldn't be able to give me the injection because of the creatinine level.
Right.
But I wasn't too concerned about it because the next time I would be able to, it would be all right.
Sure.
And then about the early 2000s, my levels jumped up to the 2s and then later to the 3s. And I got referred to a nephrologist up at the National Navy Medical Center. And but he was also handling my blood pressure. And quite frankly, I was more focused on the blood pressure than I was. I never dreamed that it would ever come to the point I'd be on dialysis.
Right.
But around 2003, it jumped again. And then they gave me the word I would probably, that I did have end-stage renal disease.
Yeah.
And I decided by then to come into private medicine. I looked up Dr. Gioli.
Right. Well, I'm sure it was a good move.
And it was a good move, best move I
It's a
made.
good move. No, he's a very knowledgeable fellow, and he's a great doc to have for that purpose. And yourself?
I'm a recipient.
You're a recipient,
Yes.
so you've had kidney disease.
Yes, and I received a kidney from a brother.
From a brother.
32 years ago.
32 years ago.
And Dr. Gioli's been my nephrologist ever since.
Wow, 32
Okay.
years. So,
1975.
I mean, I hate to ask you this way, but did you have any idea you had kidney disease
Yes, I've
before?
been diabetic since I was 9.
Okay.
And I think I had it around maybe 23 or 24 years then.
Okay.
And then, so,
Well, we're
how
going
it
to
is
learn a
with
little bit about
diabetes.
diabetes and kidney disease because it is a very
Right.
big issue.
I'm Marianne's husband. I'm caregiver.
You're a caregiver.
Okay.
All right. So you're
Wonderful.
an angel as well. Coming back to Dr. Gioli, we're talking about people who have significant kidney disease, some of whom are on dialysis, some of whom have had transplants. But not many of them really had a great understanding that there was something evolving. Tell us what happens with the kidney. I guess tell us a little bit about what it does, how it works, and then at what point do you start to see symptoms and how do people understand that?
That's a pretty broad question, Russ, but we'll talk a little bit.
Okay,
about it.
good.
First of all, I'd like to first thank many of the patients in the audience are patients of mine, and I really want to thank them for coming. I asked them to come specifically because many of them have very courageous stories to tell. All of them have very courageous stories to tell, and we'll get into that. Each one of them has their own courage that, because managing kidney disease and dealing with kidney disease requires courage. And kidney disease itself is a disease that is treatable in many ways, but requires of the patient a positive attitude. And each of these patients that I've asked to come tonight have a very positive attitude about what goes on. Some are on dialysis, some have been transplanted. But getting back to your question about kidney disease, the kidneys, we have two,
Right.
are a very interesting set of organs. I always teach my residents that they're the smartest organs in the body. Cardiologists and neurologists tend to disagree with me, but the kidneys are the only organs, in fact, that can actually change their metabolic fuel for in certain situations. And but the kidneys do a number of things. They really manage. They manage fluid status. If you can think about it, we are basically water-based animals. And what we've done, what the kidneys allowed us to do, is to keep the water that we originally, our predecessors, our phylogenetic predecessors, the fish that came before us, it keeps the kidney allows us to keep that water that we live in, that our cells need in our own bodies, and to manage that water. The kidneys, for instance, filter blood and create urine at the rate of about 100 cc's a minute in a normal kidney. And if you do the math with 1,440 minutes in a day, there are you could actually filter 144 liters of fluid. That's many, many gallons, and yet we only put out in a normal state maybe a quart.
Right.
So the kidneys are amazing in their ability to manage water. The kidneys also manage our body electrolytes, the sodium or potassium, the acid-base management of our body, and in doing so, it allows us to live, again, in that same primordial sea that we carry with us, because our kidneys can manage that fluid space and that electrolyte space in a very precise manner. For instance, the blood potassium, and I'll bet every patient in this audience knows about potassium. The blood potassium needs to be kept between 3.5 and 5.5 milliequivalents per liter. Very, very small amount. When it gets too low, it has complications. And when it gets too high, it has complications, including death. So the kidneys manage electrolytes in a very, very narrow field. The kidneys are also endocrine organs. They have two major hormones that they manage. They manage a hormone called erythropoietin. And erythropoietin is a hormone that is elaborated by the kidneys, both normal and in diseased kidneys, in response to anemia. And it's the only organ that makes erythropoietin. And in that sense, when patients begin to lose their kidney function and they become anemic, they don't have enough erythropoietin to make blood. So anemia is a major complication of kidney failure and even chronic kidney disease. However, up until about 15 years ago, maybe more, maybe 20, we were unable to actually make erythropoietin, and now we are. We make synthetic erythropoietin. I mean, the pharmaceutical companies make a synthetic erythropoietin, and we give that to many of our patients on dialysis. And very few of the transplant patients, because the transplant patients now have an almost perfectly healthy kidney, right, that has its own erythropoietin, so we don't have to worry about that. So anemia is a major complication. And the second hormone that the kidneys elaborate is a hormone called renin. And without getting into the esoteric physiology, renin is a hormone that responds to low blood pressure. But the kidneys can be fooled, because if the blood vessels that are leading to the organs that actually secrete renin are damaged, the kidneys actually see or perceive that the blood pressure is actually low in the body, when in fact it might be high, but there is a blockage. If you can think of the arteries in the kidney like highways, Route 66 is wide open, but the side streets are blocked, and beyond the side street is the organ that secretes renin. So even though Route 66 is open, the organ that secretes renin still thinks that there's low blood pressure, and it secretes renin, which leads to high blood pressure. Tom talked to you before about his high blood pressure, and it's not uncommon that patients with kidney failure have high blood pressure. The other reason that patients who have kidney disease have high blood pressure is because of that fluid status. If the kidneys are unable to get rid of enough fluid, the body fills up with fluid, and as the body fills up with fluid, if you can think about a balloon, if a balloon is only filled with 2 cups of water, it's kind of flabby. If you put 2 gallons of water in it, it becomes very tense. And so as patients begin to accumulate fluid between that and the hormone, they get high blood pressure. So, in effect, the kidney manages fluids, it manages body electrolytes, it manages anemia, and to a certain extent is managing blood pressure. These 2 little organs. And in fact, the reason that patients can give kidneys, can donate kidneys, as many of the people in the audience have done, is because we're actually given 100% reserve. So if one loses a kidney or donates a kidney, they still have 100% function left. So as we begin to measure kidney function in patients who have measurable decrease in their kidney function, they've actually lost 100% already of their 200%. And now they're cutting into the second 100%. And that's what we begin to measure. So kidney disease can be very insidious. And that's an important thing to remember. There is no real symptom that you can say, aha, that patient has kidney disease. Because kidney disease is very insidious. The human body reacts to dramatic changes in its environment. So, for instance, if we all had normal blood pressure right now, and 4 minutes later we all had very high blood pressure, we'd all be holding our heads. But if we had normal blood pressure now, and a little bit higher blood pressure 6 months from now, and a little bit higher blood pressure 6 months later, and ultimately ended up with really, really high blood pressure, because the change has been so gradual, you don't even feel it. And many patients are very hypertensive, have high blood pressure, and don't even know it because it's happened so fast. It's the same with kidney disease. Patients can survive and be totally unaware that they have advanced kidney failure even if they've lost up to 90% of their kidney function, and in this case 190%. So patients with kidney disease have very, very slow changes. And if in fact they think about how they felt at a particular time and then thought back a year before, they would say, yeah, maybe I feel a lot worse than I did before, but not yesterday. Right. So the onset of kidney disease is usually very insidious and very slow, and so patients really, although they may be feeling very bad, don't know that they're feeling bad. And the attestation to that is when patients go on dialysis, frequently they'll say to me, my God, I didn't know how bad I felt. And then they get dialyzed and they feel better. But if you ask about particular symptoms, the major symptoms of kidney disease, the most obvious ones, are fluid retention. And that doesn't mean if you have fluid retention you have kidney disease, but it's because kidney disease is part of the whole body disease. Fluid retention, usually increasing fatigue. Just kidney disease itself is fatiguing, and then the anemia that goes along with it is another thing. Loss of appetite. A very insidious change is what we call reversal of the diurnal cycle, so that people sleep all day and are up all night. And so, now, because those of you who are night owls, that doesn't mean anything. They're still, you don't have kidney disease, but you can sleep all, that's a reversal of the diurnal cycle. So, so those are the kind of symptoms that you have. As kidney disease progresses, nausea and vomiting become very much an issue. Mike told you about that. And kidney disease can affect every organ in the body. It can affect the lungs, even without fluid overload. It can affect the heart and the sac around the heart. So people can come in with no kidney function, never having known they had kidney disease, but their complaint is pain, and they actually have inflammation of the sac around the heart. And that's really an evidence of severe and advanced kidney disease. And even that fatigue phenomenon we talked about earlier can progress to seizures. So there's no one symptom that tells you have kidney disease, but all of those symptoms together, as one progresses, are contributing to kidney disease. Having said that, nephrology today is designed, and it's because of good primary care physicians who refer early. Tom told you a little bit about his. Is designed, and others have told you also, that when we see kidney function worsening, we try to intervene early. Some patients in the audience here were transplanted without ever having gone on dialysis because we caught their kidney disease early. And so nephrology is really designed to get people treated as soon as possible so they don't get sick, and that's the whole point. So that's a long-winded answer.
But it's very poetic, and I love the allusion to us living in a sea that we escaped from, and containing it within our bodies, and using the kidneys to balance the salts and and all the other hormonal functions it does. Interesting, the EPO is the EPO, which people hear about. It helps people make more red blood cells, but certainly we hear about our runners and track athletes and our bicyclists, world class, who use that to generate more red blood cells so they can carry more oxygen when they have a competition to come through. But I do want to hear a little bit more about how things evolve and how kidney disease really does develop. I mean, there are a lot of different causes, a lot of different contributions that different diseases can make. Did you have an underlying disease?
Not that I'm aware of. When Dr. Gioli's predecessor in my treatment, and then he and others would ask, I'd say, I don't have any kidney disease. You are telling me I have it. And after, of course, the measures kept showing up, I didn't deny it, but I said, I have no symptoms that I'm aware of. Show me the symptoms and I'll tell you if I have any. The only one they could come up with was high blood pressure.
So, and high blood pressure, did you know you had high blood pressure?
Yes, I was taking pills on it before I realized I had kidney disease.
And did you have a family history for high blood pressure?
No.
Your father, anybody died of stroke?
I'm the only one that I know in my family that has high blood pressure, had high blood pressure.
And when we talk about high blood pressure, what was it for you? What was high blood pressure? What
Nothing.
were the numbers?
It was
untreated, let's say.
My blood pressure got up as high as I can remember under the pills as 180 over 100 and something, which is way too high, as he would tell.
Of course.
But before I had the medicines for it, I had no idea that my blood pressure was high.
And so you could have been walking around for a long, long time with a high blood pressure, just enough to cause some injury and damage to the kidneys too.
A year, because about 10 or 15 years ago, at my age, I started having annual physicals, and that's when, as Dr. Gioli mentioned, the primary doctors, if they catch it early, they send you to a specialist.
Right.
He did.
Okay.
And then she transferred me to him. And I want to mention something now before I forget it.
Okay.
When I came to him, I had just gotten to the point where I was able to and willing to accept a transplant. And my wife was willing, and they had determined that she was a good match. Right. And he said, I don't want you to go on dialysis if you're going to have a transplant. And I said, well, how are you going to stop my kidney function from going down the way it is? He says, I'm going to give you a diet that is low on protein because protein makes your kidneys work harder. So when I went to Outback for my usual 13-ounce steak, it was the 6-ounce and no more meat for the rest of the day. So I have to give him credit because my kidney function was low and going down constantly. For those 2 months, it was stabilized at a low level, but stabilized. And as a result, I never had to go on dialysis before the transplant. So I give him credit for that.
But you bring out an important point, and that is about hypertension. And when we talk about some of the causes of kidney disease, those silent things, and you hear about the silent killer, hypertension, and certainly there are ethnic and other kinds of population, let's say, vulnerabilities to it. But it takes time for that damage to accumulate. But, people think, 130 over 90, I can get by with that. That's okay. They go to the grocery store. But hypertension's a big cause.
It absolutely is. And in addition to the kidneys being the cause of hypertension, they're also the victims of hypertension.
Right.
Hypertension affects 3 major organs, as you know. It affects the heart, the kidneys, and the brain. So it's important for people to have their blood pressures under control. It's probably one of the biggest killers of kidneys, if you will, and of the human being. It's a major problem.
And in the last couple of years, the American Heart Association has come out with new recommendations with actually lower levels than are expected. Interesting story about blood pressure, of course, is that years ago, doctors figured as you got older, your arteries got a little bit stiffer, and having a little increase in your blood pressure was pretty normal. And if it went up to 150 over 90, it was probably just because you lived a good, healthy life, and they were just getting a little stiffer. Well, we didn't realize it really had more to do with other kinds of organ disorders. And in fact, that was going to bring your demise around a little bit quicker than it should have.
Right.
So you also have an interesting story. You're here as a donor, but just to give us a little quick once-over as to why and how, because it's an interesting story as well.
Yes. About a year ago, I have an identical twin sister, and we were on vacation, and she started to get sick, had flu-like symptoms. Her vision started to go, and I think that's also another symptom of kidney failure. It's a result of high blood pressure, I believe. And she went to the doctor and went through some tests, and we found out that she had an aggressive form of kidney disease called IgA nephropathy. I don't know if the doctor has ever worked with other patients with it before.
Of course.
Yes. So we were really lucky in that I'm her identical twin, and we were able to have a transplant within a couple months, and there was virtually no chance of her rejecting my kidney because our kidneys are identical.
And she wouldn't want to insult you anyway.
And exactly, yes. So, yeah, we were really lucky how it turned out.
So for her, she was as healthy as can be, seemed to have no care in the world. And how old was she when she was diagnosed?
It was a year ago, and I'm 24, so
Right.
we were 23.
23. So that's pretty young
Yeah.
to have what can be a very rapidly fatal condition. And IgA nephropathy, so that's one of the less common causes of
Actually, it's probably one of the
kidney
most
disease?
common causes of kidney disease in
Is
the
that
young
right?
in the world.
in the young.
In the world, yes. And it's a spectrum of diseases that have the immunoglobulin IgA as a depositing factor. Interesting about identical twins, the first transplant was taken between identical twins. And in
How long
fact,
ago was that?
it's got to be in the 50s.
In the 50s,
yeah.
okay.
It happened at, actually it happened at Georgetown.
Right.
Dr. Hufnagel did it. And in fact, the kidney wasn't transplanted where they are now because we didn't know where to put it. And the first kidneys were transplanted in the arm. And amongst identical twins, there is no need for immunosuppression.
Right.
So your sister probably has very little, if any, immunosuppression because it's an identical.
Yeah. Which is a real
Yeah.
ideal situation. Not one that many
Yeah.
people can aspire to.
Yeah,
but
there are diseases that do recur in transplants.
Right.
And IgA could be one of them, just so that I'm sure you were told that. And it's important that a donor knows, especially a living donor, that the kidney that they give, and there are spouses here who have given kidneys, is a gift. And all gifts have risks. And in this case, there's a gift.
Right.
Mary Ann can tell you that she got a kidney from two brothers, both of whom, blessedly, were identical donors. Identical donors.
And we're going to hear about that from her,
Yeah,
too.
but I mean, that's the kind of thing.
So-
but they're gifts, though.
We're talking about kidney disease that afflicts young people.
Yes, oh, for sure.
And I know that, as a pediatrician, I will see certain types of kidney diseases early on. More often, they're associated with tumors or infection. What are the kinds of infections that might cause kidney disease or that people need to be aware of?
Yeah, the kind of infection I think that you're talking about is post-streptococcal disease. When people have strep throats, when young people have strep throats, actually up until early teens and early 20s, there is a complication of certain kinds of streptococcal infections, the classic strep throat, everyone's heard about strep throats, in which there is a reaction of the kidney as an immune reaction in the kidney cells that causes kidney disease. That kidney disease, fortunately, is almost 100% reversible.
Okay.
And that's a good thing. Other kinds of infectious diseases are a little bit more esoteric. If you've heard, actually you probably are hearing on the news today, there was an methicillin-resistant Staphylococcus aureus MRSA outbreak in one of the high schools in the region or in the nation, and they had a problem with that. Actually, when people have chronic MRSA, chronic staphylococcal infections, they can get kidney disease in the same kind of an immune reaction, but it's not as easily reversible. And there are other kinds of diseases in which you can get infections in the abdomen, in which you can develop a kind of kidney disease that really is not reversible, and is quite aggressive. So infections certainly are part of it.
Right. And I guess at the same time we're talking about what can cause problems for young people. You have another set of diseases, I guess, that people call polycystic kidney disease, which fits a very distinct portion of the population, but that's a pretty common cause of progressive
Yes,
kidney
it's actually the
failure
most
as well.
common cause of hereditary kidney disease in the world, and it's inherited in the fashion that genetics is called an autosomal dominant, which means that if a parent has the disease, each child of that parent has a 1 in 2 chance of getting polycystic disease. And polycystic disease is usually a progressive disease that ends up with kidney failure, has ended up with kidney failure, usually in the 4th or 5th decade. So people last a while.
Right.
The encouraging part about polycystic disease is we've identified a number of positive abnormal proteins that are associated with this disease, and it's only a matter of time, especially since we now know the genome, where I think we'll be able to identify the protein metabolism, dysmetabolism that causes polycystic disease. So patients with polycystic disease are holding out a lot of hope in the next decade of not having the disease.
And we know that trauma, certainly direct injury to the kidney, or even those kinds of traumatic episodes where you lose a lot of blood and you have very low flow, can give you renal failure, often failure that you can recover.
Yes.
You have a set of other types of conditions, though, that I guess in childhood are not commonly going to progress. But in adulthood, you have hypertension. And Mike, you were saying that you had another kind of problem that was related to, and I'll come around this way, related to obstruction.
Yep.
And give us a little perspective on what happened there. Do you have some insights as to how that evolved for you and what actually ended up happening?
No, I have no idea. It was just a medical misdiagnosis. And 7 months after they treated me for a urinary tract infection, I had this eating of foods. Now, in Croatia, they do use a lot of pesticides, herbicides, and everything else. And so I figured, well, maybe it was either spoiled cream or spoiled strawberries but when the second evolution came, and bam, and I was vomiting things which I never knew of. We got ourselves to that's another interesting thing. There was a field hospital at the airport which treated all the UN soldiers from Bosnia. That was, if they got injured, that's where we were brought, and we had the right to go there. So they went and diagnosed that the kidneys weren't working, and I went to the general hospital and the intensive care unit, and then off to London for trying to get the thing straightened out.
So
but I had no idea.
You had no idea. And do you know at this point what it was that was obstructing?
No, because I had no difficulty in urinating.
Okay.
So I didn't even know if there was an obstruction, it wasn't visible to me.
And it was gone by the time they diagnosed it?
Yeah, and basically, what do they call the nephrites?
Nephrons?
Nephritis?
The nephrons.
Nephrons, yes.
The nephrons basically were burned out.
Right.
Yeah.
Okay.
And that was it.
So that's an interesting way of looking at it, too. So here you have kidney failure that actually occurs after the kidney and backs up to the kidney.
Yeah, again, once again, this is an adaptive mechanism of the body. Had Mike had an acute obstruction, any person who's had prostate disease and who's had an acute obstruction and can't empty their bladder is a very unhappy person. Mike developed this obstruction probably over such a long period of time that he never knew and he never had symptoms of obstruction. And yet obstruction obstructive uropathy is a major problem. Usually happens in the young again, but it can happen in older folks too. So.
And it can create some pretty severe problems.
Well,
usually you would expect somebody would know, because usually you're not going to be able to go very normally.
Yes.
But this was an exceptional case, and unfortunately, it resulted in terminal
and Mike's very
kidney function.
very classic in chronic obstruction. People who have obstructive disease frequently can urinate.
Right.
You know, it's chronic obstruction.
And in terms of the evolution of your kidney disease, do you have a recollection as to how these things evolved for you?
Well, I started with taking Iridia to try to clear it up as I was prescribed to do. It didn't really help the kidney, so that's when I started going more directly to Dr. Gioli, and I just couldn't get my creatinine to come low enough or high enough for him to send me off to to go have this done or go to the dialysis people to get it done. Then something else happened to me. I had a growth right in my abdomen down there, and they sent me to the hospital to see about getting it checked. And all the doctors and whatnot was coming in. I said, "Oh goodness, I must gonna die."
Right.
But
Scary.
Oh, it was. And then they said no, nothing else was affected on the other side of that infection. So while I was there, I started my dialysis, and I knew that they already hadn't done anything, so I figured the dialysis. One of the things I hear people talking about being upset and regurgitating and so forth. I have never been what you call really sick a day in my life.
Right.
All right.
And you have normal blood sugars? You have any type 2 diabetes or anything like that?
Type 2 diabetes and multiple myeloma.
Oh, you multiple myeloma too. Just by the way.
Yeah, throw that in too. But
that's why I say Jim's one of our
He's getting to be more of a hero every minute here, yeah.
People,
that's for sure. That's for sure. Your attitude is fantastic. So, and the multiple myeloma, I guess, is that something that could contribute to this?
That's another cause of kidney disease. There are a whole series of those kinds of diseases that can actually contribute. So Jim had two major problems.
Right.
One, he had diabetes. Actually, he had three. Two, he had a nephrotoxic agent, Aradia, which was given to him for his multiple myeloma,
Right.
which has known toxicity from the
Right.
kidney. And third, he had multiple myeloma,
Right.
which in of itself can give you kidney disease.
Wait.
So, and I want you to know that Jim he was talking about not getting on dialysis. He went for a year or more, because the doctors originally wanted to put him on dialysis a year before. And he went for a year or more. We followed him every month, and he did just fine. And then ultimately, his kidneys did give up.
Right. You know, you bring up another important point. He was on a medicine that injures the kidneys.
Mhm.
And they're not just prescribed medicines. There are a lot of over-the-counter medicines.
Oh, for sure.
And other kinds of agents out there that people are exposed to that can cause
Absolutely.
that problem. What are the ones that people need to be aware of?
I would say that the most prevalent class of drugs that people need to be aware of that are now over the counter are non-steroidal anti-inflammatory drugs. And what are they? Those are drugs like Motrin and Aleve and that class of drugs. Taken in proper quantities, these drugs are okay. But if you already have some kidney disease and you don't know it, taking them can worsen your kidney function. The good news about those drugs is that once they're stopped, usually you'll recover for the most part. But people can take, especially people with chronic pain who are taking probably far too much naproxen or Motrin or Aleve, they're taking many tablets a day of over-the-counter medicines that are unregulated, can actually seriously damage their kidneys.
And it's interesting because people may think that, oh, it's Motrin, not Aleve, therefore they're different medicines, but they have the same impact.
It's the same class. And even prescription drugs can do that. It's
Right.
in that same class.
And they can be even more potent because
Yes, they
that's
can, and
what will
can
happen.
cause
You'll
kidney
get
disease.
prescription strength Motrin, which is basically like taking 3 or 4 of the tablets themselves.
Absolutely.
And in the process of that damage, once again, as you said before, 25% of your kidney function is the threshold at which you start to get symptoms of kidney disease. So you can do a lot of damage
before the tip of the iceberg surfaces.
any idea.
You're absolutely right.
And you won't really know sometimes unless you're fortunate that there is some exposure in some medical exam or maybe your blood pressure check at the grocery store, and you say, gosh, it's high, I better go check it out. You have a sharp doc who decides, you better go see Dr. Gioli.
Yep.
But you have another category of kidney disease that probably is of real great significance in this country, and that was associated with diabetes, you
Right.
said. Yeah. Were you type 1?
Type 1,
Okay.
age 9.
So at age 9, and did you have a family history for diabetes that
A
way?
little bit. Nobody in my immediate family, but
No.
an aunt and a grandmother, and
Okay,
So-
and of course diabetes, I would say, has become much more of a precise disease in terms of its treatment, and people are much
Yes.
more tuned into the fact that you can't
Right.
walk around with high blood sugars, but just not too high. You really want to keep it in control, and at that time, probably when you started, it was not that precise.
there was no just thing as you couldn't just do a prick the way you do
Yeah.
now. It's so easy.
Yeah.
But, you know, so,
So you couldn't monitor, so your blood sugar could have been
oh, 400
fairly,
maybe.
yeah.
I didn't know it.
as long as you weren't feeling too bad, you
Yeah.
carried on.
You're right.
But that kind of experience can do some injury
Oh,
to
yes.
your kidneys.
It did.
Is there a heart disease in your family?
Yes.
So there's coronary artery disease and,
Yeah, and I had a
atherosclerosis.
bypass
and
5
you've
years
had-
ago.
Okay, so that's another contributor, of course, with diabetes. It makes it even worse.
Yes.
Diabetes is a pretty
It's the first cause of kidney disease.
the
in
first
this
cause of
country.
kidney disease
Yes,
in the
it
country.
is.
So you'd say what 30-40% of people with end stage
30 or 40% of people with renal failure on dialysis
Right.
have renal failure from diabetes. Marianne is a real success story, as you heard. She has normal kidney function after 35 years of being transplanted.
and so that wasn't in your arm.
No,
No,
it wasn't in her
okay,
arm.
okay,
We tried
good.
to
That
put it
was-
in her arm,
that
but
was
she
good.
wouldn't take it there.
And
So
Dr. Julie mentioned Georgetown, but when I had mine in 1975, I live in this area. They were not doing
Transplants.
transplants on diabetics from live donors because I guess they didn't think we were worth it. So I had to go to Boston to have mine.
Really?
So but
Yeah.
I had
That's
a
true.
good- yeah.
So that's a long stretch to be carrying. Now, tell us a little bit about, I mean, it's really an interesting story for you. I mean, you've had a disease. Your brothers, you have identical twin brothers.
No, they're not. One is 7 years older, the other was
Okay.
8 years younger.
Okay.
But I think what Dr. Julie meant, we were the 6 antigen match.
Right.
So,
So you had a pretty good match, right?
Mhm.
And back
And-
then, they only did 6 antigens. They probably do
Right.
hundreds now.
no, they don't.
Still
They
stick
really-
with the big
but
6?
Six
Still
or eight,
six?
right?
Oh,
Yeah, they
wow.
still
Okay.
do that. We have a different way of dealing with things, but the antigen measures are usually 6 to 8 antigens. There are only 6 or 8 histocompatibility antigens anyway.
But the story is you received a kidney from one brother.
Yes, and that was a hospital failure. I mean, mistake that I lost that
Yeah.
one up in Philadelphia.
So there was a
So,
complication in the
yes,
surgical procedure. And was
Right.
it that they didn't get the blood
Can't
flow
remember.
going right
It
or
was
something like
to do
that?
with the ureter collapsed during surgery, but we never knew it. Just failed 10 days after, I
Okay.
think. So
And that was probably pretty
Yes.
devastating for you
Yeah, it was.
at that
It's
And
a
time.
six-
6
brother,
antigen
too.
match, Dr.
Yeah.
Libby.
And we're going to hear a little bit about what it takes to go through that. And
Mm-hmm.
you were with her through all this?
Sure.
Yeah.
Sure.
You were.
Yeah, I was our cheerleader.
You were the cheerleader, yeah.
But she was easy to cheer.
It was pretty scary. You guys have been married how long?
34 years.
It seems like 35.
Yeah.
He says it all the time. He answers me.
Well, it will be, and I wonder if you're going to say it seems like 36 then too much.
But we have identical twins. We had them after the
Yes.
transplant. 2
So,
years after.
oh wow.
yeah.
So you have you've been through that. You had enough optimism to think, you know, we're going to still have a family. We're going to make this happen.
Well, I don't know if we planned it that way.
Dr. Gioli didn't plan it.
No, Dr.
Just
Gioli
happened.
wasn't happy with that.
He was not happy.
Oh, so he thought it was going to be a little
No,
bit too
it-
much stress on the old
Yeah.
Yes,
physiology
that was
here,
my
huh?
concern. Yeah.
But Marianne went to Boston. She was at Joslin.
She had to leave Dr.
Had to-
Gioli for a
Right.
while, so he wouldn't
I had to have my
criticize
kids
her
up
for
there
it, right?
too.
Oh,
Yeah.
boy.
Boston's great.
But what did you say to the doctor at Joslin? The eye person?
At the Joslin
can't
Clinic.
Well,
Yeah,
basically he said, we recommend that you abort the children.
Wow.
And this is probably, it's maybe 20, a little bit longer than that. And Marianne said, he said, you're going to lose your eyes. Very good possibility you're going to lose the vision in the one eye that you have. And Marianne said, if I abort the children, you guarantee that I won't lose my vision. And he said, I can't do that. So she said, we're going to go ahead.
Oh, yeah. And how old are those kids now?
29.
29. That's
So
fantastic.
Marianne is another profile in courage.
I would say you have to have
And
a very
paragon
positive
for people
attitude.
to look
Because-
after.
And still, you have diabetes. You've been dealing with the complications of that.
Yeah, Marianne had lost a lot of her vision, and she would be damned if she had to have no vision. So she got vision back. She went to Johns Hopkins. Went to Johns Hopkins, and through their magic, Marianne can see and read and raised her children.
Right. Fantastic.
Much to my chagrin.
Yes, God, I tell him.
That's right.
That's a good way to live life. That's right. You have to have mutual respect. And yourself, your disease, you were talking about high blood pressure. And was this a result of or preceding your kidney problems?
Well, I don't really know whether it was the cause or the effect. I've had high blood pressure in my family. My father and my grandfather and them all had, even my mother had high blood pressure. And I'm a type A personality. I was a workaholic when I was working and so forth, and so probably a combination of genes and just my personality.
And at this point, you're on dialysis.
Yes.
And tell me about dialysis. What is it? What happens with dialysis?
Well, they put these 2 needles in your arm. They had, in my case, made a fistula,
right?
Which I understand they grafted one of my arteries with one of my veins, and that causes the vein and that to back up and be bigger, so that's a better access for the needles. So they put the 2 needles in, input and output, and they circulate that blood. I understand it's only about a cup of blood at one time is out of your body, but they circulate that for about 3.5 hours, cleaning the blood, cleaning the electrolytes and so forth, and at the same time taking out the excess fluids that my kidneys have not been able to get rid of over the last 2 to 3 days, depending on how long it's been. And it's a 3.5 hour process for me. One of the things I was concerned about and in anticipation, I thought, my God, what am I going to do for those 3.5 hours? But it turns out it's not too bad. I watch movies on a portable DVD. I listen to stereo music, and I read hard copy. Right. So time passes.
Time passes. And you feel better after you have your dialysis?
Absolutely, absolutely. I'm wiped out sometimes if they've taken a little bit more. You know, if I've been bad and had to take a little bit more, but it's not.
Do you eat a specific type of diet?
Oh, like, absolutely,
Dr.
absolutely.
Gioli has recommended.
Yes, and my wife. I want to commend my wife, who's been very supportive. As soon as we found out I had this problem, she of course saw the dietitian along with me, got all the do's and don'ts, and she set up spreadsheets and made up menus. So that you control my potassium, calcium, phosphorus, and so forth, and that has been very helpful for me.
Yeah, and there is a lot to take care of, I would imagine, and I'm sure that as much as he's in control with a couple of diagnoses like he has, he needs somebody to manage those medicines.
Yes,
and probably sometimes you get pretty nervous about making the right choice at the right time and trying to keep those things organized.
Well, that's correct. I also remind him, did you take your medicine? Oh, yes, I did. So that's the main thing, is reminding him. Sometimes he would wait a couple of hours a little later, you know. Right. But the main thing I find is interesting is the diet. Right. And quite a few things that he loved to eat, such as cantaloupe and oranges, he can't have. But I found interesting he could eat mandarin oranges according to the diet. Right. He couldn't have cantaloupe, but he could have melon and strawberries and things. And so he's happy. And I have.
Well, that's good.
So
you have a kidney healthy diet now.
I do, and I have a healthy kidney as far as I know. But really, it's not that hard. The main thing is he is a diabetic, and we always did maintain as far as the sugar is concerned. So as far as low salt and reduced fat, and sugar-free. And if you find, and I go to the store, I'm purchasing things, I pick up and I look, and they say sodium is, they say it's low sodium, but it may be 190, and the regular is 150. And I say, what are they talking about?
Really?
And they're cutting back on something else. So you have to judge what you really think is right, is correct.
Yeah.
So, but it's not that bad. He's been on dialysis since June. Right. As Dr. Gioli said, we've been coming back and forth for a year.
Well, we're going to learn a little bit more in as quick as we can because we're running low on time. But I want to know, you never went on dialysis. You went straight to a transplant.
It was a little bit of a long road, but that's correct. And Dr. Gioli and his predecessor continued to say that you'll start getting sick at, 10 to 15% of kidney function. And of course, I didn't believe him. Since he kept me on that diet, that low-protein diet, I lasted 2 more months until my transplant. I played soccer 3 days before the operation. I was fine. So as far as I'm concerned, you know, this was an illness that I knew I had. The time was coming and I was going to get fixed up. My wife's kidney is wonderful, and I had no worries.
Right.
They were both more worried with my.
So you're talking about recently playing soccer. You still playing soccer?
I coach 13-year-olds with my son.
Good. I'm glad, because I think when you have someone's kidney and she's only going to give you one, she's not going to give you the second one, you don't want to take any chances.
So I coach 13-year-olds. I scrimmage with them, but I know how to do it. I'm not trying to knock them over. I'm trying to teach them.
Right. Okay. And you stay physically then fairly fit?
After my third operation, I'm now back to 1.5 miles in 30 minutes. My goal is 3 miles in 45 minutes.
Right. Wow. Fantastic. And it was pretty intense for you to decide to donate a kidney? Was it something you had to think a lot and hard about?
No, sometimes there is no choice about.
Right.
You have to do it, and that's it.
And it was fortunate that you matched well enough to be able to do that.
Yeah.
So for you, it was a reasonable process, and you were willing and ready.
Well, once we found out that he needed a kidney, so I said, well, you need to test me and my kids, but I didn't really want my kids to do it because they're young and all that. So I was just praying for the Lord to give an answer, but I never asked to be me either.
Right.
And I'm praying, and that then I saw something, and then I said, okay, I know you will give us the right kidney for him. And then I went to the hospital with him, and they tested me, and they called me next day, oh, it's a match. I said, okay. Then my daughter said, Mama, have been praying for the kidney, and she says, but I should ask what to ask for. I should ask not to be from you either. We both praying not to be from them.
Right.
And they were praying, you know, for a live kidney, but not from any one of us, you know. But
Can I just point out something?
Sure thing, of course.
The hospital decides, since I had 4 potential donors, they decide who they test. They tested my brother first, genetic relationship, failure because of 2 kidney stones.
Right.
He had 2 kidney stones. They decided to test her next. They had questionnaires. They knew what they needed to know about my son, my daughter, who were the other volunteers, and her. They chose her, and she matched. So they stopped right there.
That was fortunate. And we have someone here who we haven't heard from, really, but you're a healthy person. You don't
Very
look
healthy.
like you've suffered much from kidney disease, but you're a living donor.
I am. 7 years.
7 years. It's something that is fascinating, because I think people think about what they sacrifice. You know, it may be $100 to the Kidney Foundation, but you've made a pretty significant living contribution. Tell us a little bit about how that evolved and
I'll
what
do it quickly,
motivated
but
you.
can we do a timeout for a second?
Sure.
Marianne at the end of the row here.
Yes.
Did I hear correctly on this end of the room? Do you have a kidney in you for 32 years that was transplanted?
Yes.
Yes.
Can we stop for a minute and give it up for Marianne down at the end of the row?
All right.
That's
Yes,
unbelievable.
it is unbelievable.
That's totally
isn't it? You
unbelievable.
got to take good care. Not only
It's a
that,
good
with
thing.
diabetes and coronary artery disease, it's
And delivering a set of twins.
set of twins.
That's great.
And not
Amazing.
listening to Dr. Gioli.
Right.
That's good.
For the most part.
But it is, and so you're a donor,
That's
and
I'm a donor.
it
You're meant
certainly
for life.
gives you some cause for feeling very good about it,
Yeah.
because if that can last 32 years in someone,
I hear the stories.
amazing.
Everyone here has got a different story and a different reason that they're sitting here. Yeah, I donated. For me, I was didn't have any health issues. I can't remember being sick, and being able to donate for somebody. You know, the big question that people ask. You know, we have a twin sister over here. Why did she do it? Well, her twin sister needed one. If you could help somebody, whether it's the person sitting next to you, or the doctor up there, or the guy who's running the TV cameras, if you could help them. If someone said to you, the person's not going to be there tomorrow, they need your kidney, they're not going to wake up, they'll die, wouldn't most people consider doing that?
Sure
I've got to think so. I've got to think most people would. So there are actually more and more programs that are allowing people to step forward, say, hey, I'm healthy, I feel good, I've got 2, take one. And they're doing it.
was it a situation where you knew someone who needed it, or that somebody appealed to you in a way that all of a sudden caught you off guard? I mean, not many people are going to say, you know, I'm not doing anything next weekend, I'm going to the hospital and giving up a kidney.
No, not many people will, but many people are. I didn't know the person until 3 months after the surgery. It came about because of, a long series of events, but the short answer is, if you can and you're able to, and there is doctors willing to take it from you and put it into someone who needs it, that's good. So I'm living proof that as good as that surgery could have gone for me 7 years ago, it did. I'm healthy. The recipient is great. She hasn't been on dialysis since the week before surgery, and happily ever after.
So far, you've been able to do something really wonderful that you recovered from quickly?
Pretty much. I was back at work 2.5 weeks later.
2.5 weeks later. And you're involved in helping people find ways to get the opportunity to donate. Give us a little perspective on that.
Oh, Fairfax County, thanks to its former chairman, Jack Harity, who had a heart transplant in 1994, decided it would be nice to establish at the county level a commission which promotes organ and tissue donation and transplantation. So he established that in 1995. It's a voluntary group, 21 members from each of the magisterial districts, plus to make sure it's integrated, we have someone from the medical community, which is Inova. We have someone from the faith community, and that varies over the years. We have a representative from the National Kidney Foundation, American Heart Association, the American Association of Tissue Banks, the local organ procurement organization, which just changed its name, so it's now Washington Regional Transplant Community.
Oh, it's not the consortium.
No, they decided
okay.
after 20 years.
Sounds more friendly.
And so we meet once a month and we promote organ and tissue donation. And we just got an award. I think you saw it over there.
Right.
We basically got all the public employees in Fairfax County, Arlington, Alexandria, and the city of Fairfax have leave policies in place for their employees to be organ donors. And it took 3 years with all sorts of people twisting the arm, but eventually Inova came through, and we were honored on September 24th. Inova, being the largest private employer in Fairfax County with over 10,000 employees, has an organ and donation leave policy in place, and it's actually being used.
Fantastic. And I could have taken off more than 2.5 weeks.
Well, I'll tell you, you could have taken off, and you deserve a lot more off than that for doing what you've done. And it certainly is something that people should consider and certainly can look into. We have a website, www.kidney.org. You can learn a lot about kidney disease and the things that go on there, about transplant and all of those sorts of things. I want to thank you all for being here. I want to thank Dr. Gioli. His information is priceless. And I want to thank you for watching. And of course, until the next time, I'm Dr. Russel Libby, looking out for your health. So, here we go.